your pleasure.
I'm here with Dr. Mulholland, and I want great legs for the summer. I've got these veins that are happening. I know that a little bit of cellulite has crept in, even though I work out with Dave and I walk and all that sort of thing. Is that's normal for a woman my age, 35? No, over 40, over 45. Is that all normal?
It's all very normal. So if we can treat leg veins, unwanted hair, cellulite, and fat, you can have a very shapely, smooth, attractive leg.
Sign me up.
What we're doing here, Marilyn, is we're going to be doing a little bit of hair removal.
So I just need a little bit of stubble.
This device sends laser energy and a little bit of radio frequency electrical current down the hair shaft, and it's like very, very fast electrolysis. We can move along very, very quickly with this laser device.
Yowza.
A little bit stingy.
A little stingy near the bone.
Yeah.
Yes.
It's a very thin skin there, but again, you have to kill the hair shaft so it doesn't grow back.
Right.
And a little bit of stinging is very tolerable, much less than would electrolysis or waxing.
Okay.
And so we can cover the whole lower leg in about 10 minutes.
Wow. And how many sessions does one have to make sure that at least 70% of this is gone?
Well, when we bring people in for a common hair removal, we tell them that they're going to need 5 treatments to get about 50 to 75% permanent reduction.
Okay, next up are veins. Now, I don't have any whiskey with me, so I'm going to hold on to this baby. Go ahead, hit it.
Okay, we're just turning on the leg vein device here, and there's 2 ways to treat leg veins. Once you've controlled the high leaky stuff, then we're going to deal with the little tiny spider veins like you have here, and a little spider vein complex here, and some of the big blue guys that feed them. And we use a combination of needle-based sclerotherapy and then our leg vein laser. It sends a diode laser and a little bit of electricity into that leg vein, and you will see it shrink right before your eyes here today. Beautiful legs for summer. We've gotten rid of hair. We've gotten rid of the leg veins. Now we're going after cellulite and fat. This device called the Vela uses radio frequency electrical current and infrared laser light to melt the cellulite, improve the cellulite, tighten the skin, and melt localized fat collections. It stimulates almost like localized weight loss, an area of what's called lipolysis, or the breakdown of fat cells. It also improves the quality of your skin and smoothens cellulite through that same technique, breaking down the little globules of that cottage cheese, lumpy, bumpy, pot orange sort of skin. So you're joining the LipoLite gym for 8 weeks, and you're coming in and you're getting our treatments twice a week for 8 weeks. At the end of that program, on average, we can shrink between 2 and 4 inches of your thighs, between 2 and 5 inches of your tummy, and we get about a 60% improvement in your cellulite, and you get skin tightening.
It's always good working with you. Working with you, you know, it's always good. Okay, this we're going to do on your leg. Okay, but you know what? Already, we're going to talk about this towards the end of the show. We're going to talk about the cellulite, the Vela treatment, which I'm undergoing right now. Which is, you know, I've seen the difference. I think I've been in it 4 weeks, and there's a big difference. So we'll talk about that a little later on. But we're going to talk about veins first. Veins and then hair removal. Veins, I had a vein removed last year. Dr. Morton did it, and it was my pregnancy vein. It was that big vein that, you know, you're walking down the beach and all of a sudden it's really hot and it pops out, and you're going, okay, we got to get rid of that one. So we did that, and that wasn't a very painful experience, but veins can be painful. Is that the sign that something needs to be done?
Veins are a stubborn and annoying problem.
They are.
Generally, as you get a little older, you've had your children, there's been the weight loss, weight gain, and hormonal changes.
Yes.
And generally, most of your viewers need to understand veins is a problem that starts at the groin, usually.
Yeah.
And you have this leakiness, and then you have all these little spiders.
The little red ones and the little purple ones.
And most people, most clinics, most physicians go after the little leaky ones without treating the problem in the groin.
The feeder.
Right. So you have to you have to fix the dam before you go after the little creeks and tributaries. So what you had was what has replaced high ligation and stripping, which was really quite a morbid operation.
Yeah.
This is
just
a little,
the word we'll have to strip your vein sounded so painful, and it was.
And it was. Now we can stick a little laser upside in the pregnancy vein, the one that dilates, and usually in about 15 minutes control that. Then you come back after, which is what you've been doing, and going after the little spiders and the little annoying visible cosmetic concerns. So there's some women that have throbbing, swelling, and pain. Those are usually the big veins. And then they've got the cosmetic concerns that show up when they're wearing shorts shorts or bathing suits or sheer nylons, which are the blue guys and the spiders.
Right.
And generally, a combination of laser and some sclerotherapy will give you over 75 to 80% clearance.
We're going to show you before and after right now. Take a look at this. And by the way, I should not be crossing my legs because what am I causing?
Certainly, you increase the pressure in the veins.
When you cross your legs, you increase the pressure of the veins. So I don't care. I'm wearing a skirt, and my mother always said, cross your legs. Okay, so that's what I'm doing. Take a look at this before and after. Talk us through this one.
It's an individual that would have some throbbing and discomfort, and that's a big, large, dilated vein.
Yeah.
We would go up into the groin under local anesthetic and do a laser internally to close off the deeper system.
Right.
And then once this is gone, then you can go after the tiny little spiders around it and get a very nice improvement in the aesthetic and the functional concerns that patients have.
You have to have your leg wrapped, and correct me if I'm wrong, for a couple of days to keep it tight and then what you suggested is that I went for power walks that night. I walked and it just got things moving again. So it wasn't as bad as I thought.
No, we don't like to keep people sitting with their legs up. We don't want to get any blood clots, things like that.
Yeah,
so we
that's right.
You get very active, get back into your normal life, and within 4 or 5 days you're back to exercising, but you can be shopping and walking around the next day.
And skin types, is there a skin type that cannot do this?
Generally the darker skin type, so when you're talking skin type 5 and 6, which would be Asian, Hispanic, Native Canadian or Caribbean Canadian, they are more prone to pigmentation issues, and so we're much careful with them. But anybody who's got olive skin down to the whiteys would do very, very well because there's not as much concern about discoloration.
Okay, all right. Staying out of the sun is always important too, right?
Yeah, very much so. I think that the spray-on tans look very natural now. There's no need to sun damage yourself.
Yeah.
And after laser treatment, you need to avoid the sun for a couple days.
You do. Okay, and before and after on this one?
Again, not so tortuous, but again, this big vessel will feed a bunch of little spiders around it.
Yeah.
So we treat the big guy, and then after, the little guys are much easier to treat.
It's pretty amazing, isn't it? I mean, it really can clear it up. It looks really, really good. We want to talk about hair removal. We have time for that? 1 minute for hair removal.
It's probably the second most common thing we do after Botox, because unwanted hair of the face, the lip, the chin, the sideburns, generally in our Western culture isn't viewed as attractive, although for some people it is. Okay. And then the body areas, the bikini, the armpits, and the legs. We've got nice systems now that are fast, that can treat red, blonde, and gray hair, and even darker skin types. So hair removal is something that if you don't like it, we can usually laser it. It'll be fast and reasonably effective. Okay, so what should you do first? Well, assess what areas really bug you. Make sure that you've seen a physician so you don't have any hormonal reasons like endocrine tumors or adrenal gland problems that are causing it. And then decide, okay, am I willing to lay out that kind of money and over 5 treatments get 75% of the hair that doesn't grow back on average? And do your research, make sure the facility has a lot of experience doing hair removal. Yes. And at the end of the day, you have to have a vision of a smooth surface where you're not going to be waxing and depilating so you don't get those little bumps and irritations. Isn't the hair in certain spots in our body there for a reason? Yeah, generally, teleologically. Do you hear what I'm saying? Well, seriously, they are. Yeah. Okay, to turn away potential suitors, yes, that's one reason. And then there would be, generally, of course, protective and warmth, but we now have air conditioning and duvets. And so most women do it for aesthetic reasons. Yes, okay. Some do it for ingrown hairs and things like that. But most do it for aesthetic reasons. It's purely a cosmetic decision. Okay, and really, generally speaking, the cost of getting this done? The cost, usually you buy 5 treatments. Right. And after 5 treatments, if it's a small zone, it will cost you anywhere from around $1,000 for the 5 treatments, up to several $1,000s to treat your entire legs. It takes about 6 months to complete. Yeah. And after that, you go
don't
into...
have to do it,
if you get a really good result, you're done. Okay. If you have some 25% of the hair that's stubborn, you do it about once every 6 to 8 weeks. Okay, so we covered veins, and we covered hair removal, and a little later on, we're going to talk about cellulite. And fat. Cellulite and fat, man. Just can't seem to get rid of it until now. Well, we do have a non-surgical option for that, and that's made it very accessible and interesting and exciting for patients because all that existed before was liposuction. That's kind of scary for a lot of people. Yeah, that's right. Everything costs money, everybody, and it's painful. And with that, we'll take a break. We'll be right back.
Feeling bored? I was until I punched up City. You know, if there's anything I love, it's...
Back to CityLine. It's our leg special today, and keeping in mind with legs as being our theme today. Everyone in today's audience will get melatonin from our sponsor Vividus, because you have to have a good night's sleep to rest those weary legs. You do. If you're suffering from insomnia, this is from our sponsor Vividus. And after the show today, we're drawing for a gift bag with sleep-inducing products. Go to the CityLine website and click on Vividus to win prizes. We thank them very much. With this hot weather in southern Ontario, nobody's sleeping right now. Okay, now Dr. Mulholland has returned, and we're going to talk about cellulite and fat. And I'm going to ask downstairs that they show a picture of what we know as being really uncomfortable and awful and whatever, but cellulite and fat. Okay, let's talk about this picture before and after.
Well, cellulite and fat takes many forms, and the two, some women get the two mixed up. Fat is that, you know, that stuff you can grab in your hand and it jiggles and wiggles and that ruins your nice contours and shapes.
Right.
Cellulite is the skin. It's the lumpy, bumpy cottage cheese skin that even very, very thin people can have.
Yes.
So this young lady, this is her back and this is the bra line, a very common area to have a roll that sticks out in a tight blouse or shirt.
Sure.
Liposuction would have been the only thing we could have offered her. The LipoLite program sends that, as we showed in the last segment, that electrical current and that laser-like light into the fat. The device is called the Vela Smooth, and you can get really nice, noticeable changes. So for fat, we get 90% of all patients respond to this treatment, and the average is between 1 and 9 centimeters of shrinkage without liposuction. So it's like a non-surgical liposuction.
Over a series of how long?
Okay, it's like joining a gym. It's over 16 visits over 8 weeks.
Okay.
Now, once you've melted the fat, if you don't feed those little fat cells again, they're not coming back. So you don't need to do maintenance treatment. So it's a one-time deal. Just monitor your weight after that. So outer thighs, inner thighs, bum, calves, arms, and tummy. Those are the most common areas.
Okay, get ready for this picture.
This is more cellulite, the lumpy, bumpy cottage cheese skin, and too much fat. So it can be a combination treatment.
Right.
And so we can get about 50% of our cellulitic people responding. Now remember, 50% don't respond. Cellulite's like high blood pressure and diabetes. We don't know what causes it, but at least now we have a treatment where the majority of people respond.
Right. So, okay, so my question to you...
One last thing. If you have cellulite, you're coming for the rest of your life. It's like high blood pressure, diabetes. You need to take your insulin, your antihypertensive, and your LipoLite treatment once every 6 weeks for that smooth skin. So if we melt the fat, you're okay, you're good to go. But cellulite needs maintenance. It needs maintenance treatments once every 6 weeks.
So after you do...
your cellulite program over 8 weeks, you're coming about once every 6 weeks to keep that smooth skin.
Okay, and a part of that is that machine.
Yep.
And part of it is some shots.
Some needles, We use chemicals that we inject with a fine needle to stimulate reduction of the cells that are causing the problem.
That's what it does. So when you get those shots,
it's a chemical stimulant to break down unwanted fat. And then with the Vela adds the energy from the outside, so we use heat and chemicals to basically simulate localized weight loss. Because if you lose weight and you do it with a caloric restriction, you can lose it off your face, your breasts deflate, all the areas you don't want to lose weight. But of course that annoying thigh and that tummy and that pot is still there.
Along for the ride. Along for the ride.
This has been very exciting because it's now allowed us as physicians to really offer a non-surgical liposuction option.
Yeah, so when you come in, you should, as far as your weight is concerned, because you should stay within 10
I think
pounds
within about 20% of where you think you want to be. And of course, if you lose weight after, great. We're just going for localized contour. But you can't put weight on after. You're going to ruin your results.
No, it's proper diet and exercise. Okay, so all things to investigate. If that interests you, come on, why not? Look into it. It's so good that you don't always have to go to liposuction.
Yes, well, as a plastic surgeon, I don't want to put myself out of business. But the real demand is for non-surgical options. And that's what's been so nice, that it's affordable, reasonably, and there's no risk.
Okay, and it's also maintenance, and it's up to you to keep up that maintenance. Thank you, Steve. We're going to take a break. We'll be back right after this. Good.